So what we're doing right now, after setting up the machine is ready right now at this point. So we're preparing the access for cannulation. Okay. So first thing you do is make sure you have all the supplies. You have the needle, you have your betadine swab, alcohol swab, your 2x2 gauze, you have a Steri-Pick, and your heparin, 3 cc syringe with 1 ml heparin, and a dry paper towel to take the lidocaine, the EMLA cream off. Okay, make sure you have the tapes too. 4 1/2 size regular size tapes, and 2 1-inch and 1 long tape, 1-inch. Okay, so we open this. This is just a backup, so I'll just put that on the side. Open one pack, split it, there's 2 in 1. Okay, and we remove the cream off. Clean it with alcohol. Inside going out. And the arterial inside going out. Then we take the scab off using the Steri-Pick. Okay, once the scab is off, we clean it with betadine swab. So going out. Okay, let it dry. Then apply the tourniquet. And insert the needle. Start with arterial at the bottom. Make sure bevel is up. You keep the same angle at about 30 degrees and the direction going towards this because the fistula is positioned that way. Okay, support the fistula. And then the anchor tape. Now the venous, the same technique, bevel up, same angle, about 30 degrees, direction towards that way. Then remove the tourniquet right away. Okay, and then we cover then we bleed the lines. Until the very tip. Close the cap and clamp. We do the same with arterial. Just loosen the cap. Bleed it all the way to the tip. Close the cap and clamp. And then we administer heparin. We administer the heparin into the venous port. Open the cap. Attach syringe. Keep it upright. Tap for air. Start with a pull. Flush it about 3 to 4 times. And then stop until where you see the air bubble is. Okay, close cap. Clamp. Then we secure the line with a long tape. And there you go. The access is ready. Now we make connections, patient lines to patient's access, red and blue. Okay. First thing we do is we prepare the syringes. Open the syringes. These are caps, so you can lay it down. Clamp 4 clamps patient lines to red and blue at the saline bag. 1, 2, 3, and 4. We start with arterial using the 10 cc syringe. Uncap. Disconnect. Loosen this. Secure the line. Red to red. Okay, give it to the patient. We do the same with the blue line using a 3 cc syringe. Disconnect, secure the line, attach 3 cc syringe and connect patient line blue to patient's vascular access blue or venous. So at this point we open 4 clamps, patient lines that's attached to the vascular access. 1, 2, 3, 4. And then we confirm that the system is ready. We check for the green line or the dialysate line. Make sure they're clamped. Are they open? I mean the clamps are open and they're not. So make sure these are open. 1 and 2. The filter is positioned in the filter holder with a venous port upright. Yellow clamps are open. 1 and 2. 2 white clamps are closed. This is the saline line. Fluid detection sensor is positioned in the cycler base.
Okay.
It's okay. Alright. So the system is ready. Now we press go or treatment. The green kidney. So at this point our pump speed is 200 mLs per minute. And we check for the arterial and venous pressure. Running at 200 pump speed, our venous and arterial pressure should be below 100. So our arterial is 34, 55, 45. So that is good, that's below 100. And we will just wait for the venous. And the venous is 14, 15, 19, 20. Still below 100, so that's good. Now we can increase the blood flow rate to 400, which is the prescribed blood flow rate. Okay, so this time we check the pressures again. Now this time the blood flow rate running at 400. The pressures, the arterial and the venous pressure should be below 250. Okay, so the venous is 168, 165, 171. So that's below 250. So the venous pressure is good. We're just waiting for the arterial. And the arterial pressure is 165, 169, 174. Arterial pressure is good. At this point we max out the dialysate flow rate. This is the dialysate flow rate here. We just press on the up arrow until the light is off, or until it stops going up. Okay, so at this point it's locked at 9.5. Okay, so once everything's up and running, we secure the line with a blue clamp. Okay, put the feet up. Okay, and make sure you do not cover the access. And we can clean the table. Sharps goes to the sharps and cleaner. That's it. It's good. And then we do the first line of the flow sheet. Remove the gloves. And then we do the first line of the flow sheet.